Removed. Raising the profile of assistive technology. Having the right assistive and accessible technology, ATEC, allows disabled people to more fully enjoy and take part in education, work, travel, retail, sport and culture. This means ATEC which is sensitive to their requirements. Affordable and adaptive to their needs. The range and application of assistive technology is varied and evolving quickly. The market is crowded, with many different choices and little reliable guidance. Cost is an increasing factor. The government wants to make the UK the most accessible place in the world to live and work with technology. This is part of its wider vision to transform the lives of disabled people. By working across government and with the ATEC sector, we want to ensure that assistive technology is available to people who need it, disabled people are confident in using it. Summary of consultation findings. 90% of respondents agreed that the government needed to do more to help disabled people to find and use the right ATEC. But while many respondents agreed with the proposal to upskill public sector staff, many did not think it was the most urgent or helpful thing to do now. Instead, they highlighted a range of issues which the government should explore further. These issues include the availability, affordability, and constant renewal or improvement of ATEC. Responses said that these are difficult for members of the public to keep pace with. This matches the findings in the Assistive Technology Changes Lives research by the Global Disability Innovation Hub, GDIH, funded by DU and published in July 2023. Specific issues raised by consultation responses included the changing ATEC needs of disabled people throughout their lives, as outlined in the Business Disability Forum's Technology for Life model. Regional differences in access to ATEC. The difficulty of navigating existing government schemes providing ATEC. The barrier caused by digital exclusion. The issue of barriers caused by digital exclusion was most frequently mentioned by individuals. This finding matches research by the ONS, which shows that 59.4% of adult internet non-users in 2020 were disabled. While the number of disabled people who are internet non-users has decreased over time, the gap in internet use between disabled and non-disabled people has increased. The National Disability Strategy included an action to invest up to £1 million in 2021 to 2022 to develop a new Centre for Assistive and Accessible Technology, CAAT. Reporting on progress by summer 2022. Work on this was paused in 2022-2023 due to a High Court ruling. This ruling has now been overturned at the Court of Appeal, allowing work to recommence. The government will therefore restart work to take forward the establishment of the CAAT. This will create a national focus for expertise and would be well placed to bring together relevant government departments including the Disability Unit, the Department of Health and Social Care, the Department for Science, Innovation and Technology, and other government departments, business, academia and the tech sector, with a view to sharing information on the technology which already exists to improve people's lives, and to identifying areas where further innovation is needed. It could propose actions to address issues raised in the Disability Action Plan consultation, and the findings of the GDIH needs assessment and proposals included in the Assistive Technology Changes Lives research. To ensure that a new CAAT can determine its own scope and work programme, and in line with consultation findings, we will not take forward the Disability Action Plan consultation proposals in this area at this time. Disability Unit.